Good morning. Happy Monday. Today I'm going to talk to you guys about ear infections. So, first of all, there are different kinds of ear infections. You can have an inner ear infection versus an outer ear infection. So, an inner ear infection is the one that is behind the eardrum that a parent often cannot see when they're just looking in the ear like this. So, this is the one where we use our otoscope here and we actually shine the light in and we can see behind the eardrum and see what's going on. An outer ear infection is the one that's a little bit more the typical swimmer's ear, where a parent could actually just look in this ear and you could actually see the ear canal itself might be really swollen and just have a lot of stuff in there. But usually you're going to have some swelling of that ear canal itself. So, little tricky here though, you can have drainage with both types. So, if you see goo coming from the ear, that does not automatically mean like, oh, this is swimmer's ear or oh, this is an inner ear infection. Because what can happen sometimes that with the inner ear infection that's behind the eardrum, number one, if you have ear tubes, you're going to drain. There's a hole right in that eardrum that allows drainage, so you're going to see the goo come out. Also, if you get a lot of pressure behind that eardrum, a lot of times the eardrum will rupture, and that'll cause some bleeding and some drainage. So that's why you can't, just with drainage from the ear, you can't automatically decide what type of ear infection it is without actually looking in the ear, having the doctor look in the ear. There are other factors that go into this as well with what type of ear infection we're dealing with, but I'm just trying to give you a very broad, generic overview here, so always talk to your doctor with more questions and stuff. One of the main points I want to get across here is we are trying not to be so quick on the antibiotic trigger lately, so we have a major problem with antibiotic resistance right now in our country. So you might notice some changes being made. I know I've adopted these into my practice over the last few years, and a lot of other pediatricians are following suit. So, pending your child's age, specific symptoms, how the ear actually looks on exam, your doctor may say, hey, we're going to wait on this. We call this the watch and wait method. And so we're going to see what happens over the next 1 to 3 days. The ear infection may completely resolve on its own. We call this just self-resolution. Again, many factors go into this though. So it's not going to be very black and white where your pediatrician's like, oh, they have decisions before you even come in about who's going to get antibiotics and who's not. It's very case by case. So they'll do an exam, they'll take a good history. This is what should take place. And then make a decision on whether or not your child needs antibiotics right then and there. So don't panic if your child has an ear infection and is not put on antibiotics right away, as sometimes they are not always necessary. And that is your tip for today. All right, guys, if you have questions or comments, just leave those below and I will get to them. Bye.